Today, we are going to talk about megaesophagus in dogs. Megaesophagus in dogs is a disorder where the esophagus becomes enlarged and weak, so it can no longer move food and water into the stomach normally. Instead of peristalsis pushing a meal downward, the esophagus acts like a loose storage tube. Food, water, and saliva sit there, then come back up as passive regurgitation. This is different from vomiting because there is usually little abdominal effort. The biggest concern is aspiration pneumonia. Megaesophagus may be congenital, especially in puppies that begin regurgitating around weaning, or it may be acquired later in life. In adults, many cases are idiopathic, but we still look for specific diseases that affect nerves, muscles, or esophageal outflow. Myasthenia gravis is one of the most important causes because antibodies block acetylcholine receptors at the neuromuscular junction, causing poor muscle contraction, weakness, and sometimes megaesophagus. Other causes include Addison's disease, hypothyroidism, polymyositis, dysautonomia, lead toxicity, severe esophagitis, strictures, masses, foreign bodies, or a vascular ring anomaly like a persistent right aortic arch. Clinically, these dogs may have repeated regurgitation, weight loss, poor growth in puppies, coughing, fever, nasal discharge, or increased breathing effort if aspiration pneumonia develops. Diagnosis usually starts with thoracic radiographs, where you may see a dilated esophagus filled with gas, fluid, or food. Those same X-rays also help check the lungs. A contrast esophagram can outline the esophagus, but contrast must be used carefully because aspiration is possible. Bloodwork helps screen for systemic disease, and specific testing may include an acetylcholine receptor antibody test, thyroid panel, and ACTH stimulation test. Endoscopy or advanced imaging may be needed if a stricture, mass, foreign body, or vascular ring anomaly is suspected. Treatment is based on gravity, nutrition, and treating the underlying cause when one is found. Dogs are fed upright in a Bailey chair or similar setup and should stay upright for about 10 to 20 minutes after eating. The best food texture depends on the dog. Some do better with slurry, while others do better with firm meatballs. Water may also need to be offered upright or as gelatin blocks. If myasthenia gravis is present, pyridostigmine may be used. If Addison's disease is diagnosed, treatment may involve DOCP or fludrocortisone with glucocorticoid support. If aspiration pneumonia occurs, the dog may need oxygen, fluids, nebulization, coupage, and antibiotics such as amoxicillin clavulinate or ampicillin sulbactam, depending on severity and culture results. Key takeaway: megaesophagus is not just throwing up, it is a motility failure where food sits in a weak esophagus, so successful management means finding treatable causes, feeding upright every time, and preventing aspiration pneumonia.